So I want to talk to you today a little bit about photodynamic therapy, or PDT, something we've been doing at Qutis for some time now. It's a great treatment. I wish I'd been doing it years ago. It basically centres around the effect of using a photosensitive solution, combining that with high energy LED lights, and as a result of that, because of its selective way in which it works, it just gets rid of the dodgy cells on the skin, the skin cancer, early skin cancer cells, as well as sun damaged cells, those dry crusty things that you see on people's face and on the back of their hands and other parts of their body where they get a lot of sun. Now, photodynamic therapy has been around the world now for about 20 years, in Australia about 10 to 15 years. It's a very rapid way of fixing up these problems. From go to woe, it's around about a week to 10 days, and you're back in action again, so it's pretty good. We use a solution that is very light sensitive, as I said, selectively absorbed by the bad cells, and after a period of time of allowing that to get into those cells, we then shine our high energy LED lights on them. As a result of that, little free radicals are released which don't go anywhere outside the cells, but they act like little cluster bombs and they bombard the cell wall and they kill the cell off. So if we don't put the solution on a part of the body, it doesn't work. If we don't shine the lights on a part of the body, it doesn't work. It's the combination of the two that works. And similarly, if we do it in a part of the body where there's no sun damage, we could expect absolutely no response whatsoever. So it's a really good selective treatment for this problem. Now, when we do the preparation for it, it takes around about a quarter of an hour. We have to cleanse the skin, apply the solution, and then for a period of time, anything from 1.5 to 4 to 8 hours, we allow absorption of the solution into the skin. Then, for again a predetermined period of time, you just expose that part of the body to the high energy LED lights that we use. It can be a little uncomfortable sometimes during the process, but we take that into consideration. We make sure that certainly no one is so uncomfortable during it that it can be a problem. Now, what can you expect as a result of this? We know that just about everyone the next day will wake and the area that's been exposed will be quite red. There may be a bit of swelling and often a bit of discomfort. Certainly not unbearable. You don't have to worry about that. We get people to apply pawpaw ointment and other preparations and have other little tricks that we use to make sure the discomfort is kept to a minimum. For about 2 to 3 days you might experience that discomfort. But then after that, although the redness and sometimes a bit of swelling might persist for another 2 or 3 days, we then find that there's no discomfort. People come in and they say it was just that couple of days and that's all. By the time you've had the treatment, around about a week to 10 days, you're pretty much back in social action again. You might look a little unusual for that period of time, and many people find, for example, that they need to have their week off work, take a week's holiday, but at the end of that time, then you've really got a nice clear skin with all that damage removed. There's a few precautions that we ask people to make us let us know about. Certainly one of the important things is the medications that you're on. There are some medications that actually interfere with the whole process. What those medications do is they often enhance the photosensitive or the phototoxic reaction that people have. And so we encourage people to let us know, and if there are any medication that are of concern, we discuss it and adjust it or make other arrangements if need be. Similarly too, an important thing is let us know if you've ever had a cold sore in the area, because often this treatment will precipitate a cold sore and we need to take action to try and prevent that. You have to remember that you'll need to apply pawpaw ointment or something similar for around about 7 to 10 days. Often applied 5 or 6 times a day so that it helps to soothe the skin and help it to recover and not allow it to get too dried and too cracked. But we'll find that as a result of the treatment, you'll have a very rapid, quick and selective treatment for your sun-damaged skin and early skin cancers. So we look forward to talking to you about it a little bit more. Our nurses are very experienced in the process and can help you as well, and some of our staff have had personal experience of it, and that always helps as well, so that they can help to explain a little bit of the ins and outs of it. So photodynamic therapy, a really good treatment for this sort of damage to the skin.